I am Dr. Joanne Yanez, the Executive Director of the Association of Accredited Naturopathic Medical Colleges. And we are going to host a webinar today on the role of naturopathic medicine in cancer care with Dr. Heather Wright. Before we get started, I want to just go through a little bit of housekeeping. So on your right-hand side, there's a panel. You can open it up with the chat button below. And if you have any questions throughout the course of the webinar, please feel free to throw that in the chat section and we will answer whatever we can during the course of the webinar. If not, we'll post an email address at the end where you can send any questions that you may have afterwards. So with that, I'm going to introduce our speaker today. I'm so excited to have Dr. Wright with us. Heather Wright is the president of the Oncology Association of Naturopathic Physicians and co-research director for the KNOW Project, which is a searchable database of integrative oncology clinical trials. Dr. Wright is board certified in naturopathic oncology with 12 years of experience in hospital-based oncology teams and 14 years in clinical practice. During her career, Dr. Wright became an expert in the co-management of pancreatic cancer and on intravenous vitamin C for people with advanced stage cancer. As a specialist in naturopathic oncology, Dr. Wright has worked diligently with countless families to improve quality of life and longevity. She is a volunteer and clinical board member for Gilda's Club and Cancer Support Community as a lecturer, writer, and consultant for research and publication in integrative oncology. She's published articles on IV vitamin C, supportive care, and we are so very happy to have her with us. She's founded the Good Apple Wellness Center located in Philadelphia, Pennsylvania, which offers private consultations for integrative care and specialized expertise for families affected by cancer. So with that, I am going to turn over our presentation to Dr. Wright today. And the show is yours, and I'm so excited to have you with us. Thank you for joining us.
Thank you, Dr. Yanez. It's been great working with you to prepare this, and I'm so excited to share more about the role of naturopathic medicine in cancer care, and for this opportunity. I'm just going to tell you a little bit about my background. I went to undergraduate university at St. Lawrence University in upstate New York, and then I did post-baccalaureate pre-medical education at Tufts while I worked at a Harvard research lab in cancer research. And then following that, I decided to, instead of my first year at Tufts Medical School, go to Bastyr University for naturopathic medicine. And as Dr. Yanez mentioned, I worked in my hometown hospital, actually my first year out of graduation from Bastyr in internal medicine in an upstate New York hospital and medical center. And then after 2 years there, I went to practice at a private hospital in Philadelphia, a cancer treatment hospital where I worked for 10 years. And then I've been in private practice for 2 years. And now, as she mentioned, I'm working with the OncANP.org in leadership, and I have 2 children, one age 6 and one age 16. So seeing patients, doing some research, and having a family are what I'm up to. Our agenda today is defining naturopathic oncology care. We'll talk a little bit about the statistics and how that relates to patients, and what our goals are in the training of naturopathic oncologists. I'll share some research with you that's very exciting. We are an evidence-informed profession, and we'll look at a couple of case studies in how our treatment relates to individuals affected by cancer. Before we go on, though, I did want to just do quickly a little poll to see who's attending this lecture. If you might be able to just quickly click on the option that fits for you, that's very helpful. And we'll just spend a moment to do that. And thank you so much for participating. So we have some prospective ND students, some current students, it looks like, which is great. We have some naturopathic doctors on the line, and thank you all very much for participating in that. So what is integrative oncology? The Oncology Association of Naturopathic Physicians defines naturopathic oncology as the application of the art and science of naturopathic medicine to the field of cancer care and treatment. The AANMC is our association org, but there are a lot of learning tools on that website and resources for students, for allied professions. And if you would like to gain access to the No Oncology Research Project, you can do so on the AANMC website. Integrative oncology is a more broad term for all of the allied professionals who are working with cancer patients to use natural and evidence-informed care that is adjunctive or combined with conventional treatment. So natural therapies, mind-body approaches, lifestyle modifications. Our goal is to optimize health and quality of life along with clinical outcomes and empower people to become active participants in their healthcare journey with cancer and even beyond cancer and into survivorship. So surveys do estimate that greater than 80% of people with cancer use natural medicine. That's a very high percentage, and we simply do not in conventional medicine have professionals with expertise in use of those therapies being able to answer all of the questions that patients have and really help guide evidence-informed care. So that's really where naturopathic doctors come in. So NDs trained in integrative oncology advise on the safe, effective use of natural and supportive therapies combined with conventional treatment. And we do work collaboratively with oncology and integrative providers at all stages. So at the time of diagnosis, we work with patients and communicate with their team of providers, which can include surgery, it can include surgical oncologists, heme-oncologists, radiation oncologists. We really communicate and seek to communicate so that the patient has a team care approach. Post-treatment, we're really helping people with residual side effects and learn tools for survivorship and longevity that are evidence-based as well. And many of those tools are exercise and relaxation training therapies and how to live the best life in the healthiest way going forward post-treatment. So the advanced training for naturopathic doctors in oncology is a 2-year residency, which is generally in an oncology setting or in a clinic setting with other naturopathic oncologists, and to be in practice for 5 years or have at least 2,400 oncology patient contact hours. Following that, we ask that our designees submit cases and pass a board certification exam, which allows for the criteria of FABNO, which is the Fellow of the American Board of Naturopathic Oncologists. This designation has been in use for about 7 years, and we have, I think, about 100 FABNO naturopaths in North America. So Integrative Oncology Circle of Care, this is kind of the big picture, what it looks like. The patient, of course, is at the center, and they will be diagnosed with cancer and be seeing a medical team at their local hospital or cancer center. That includes a medical oncologist, a surgeon, a radiation oncologist. Sometimes these people will be traveling to care at distant centers that they believe will offer the best approach for them. And then that is usually when they will also contact a naturopath or an integrative provider wanting a team approach for use or an incorporation of natural therapies that also support people to find what can I do on my side at home when I'm not at my hospital or cancer treatment center that will help my health, and how can I prevent or reduce side effects of my conventional treatment and support my very best outcomes. So that's what naturopathic doctors do with patients. We really steer toward evidence-based guided care from the conventional sense. So a resource tool to understand that better is nccn.org. So if that could be put in the chat box for people, that would be a really nice resource. That is the standard of care for conventional oncology diagnosis and treatment management. And many of us trained in naturopathic oncology are very, very familiar and do a lot of teaching about what the conventional oncologists are recommending. Their visits are kind of short, and it is very much a whirlwind for some people being diagnosed with cancer. So breaking that apart and working with them to understand the best treatment approaches and what options exist for their decision-making, and really empowering them to participate in decision-making is our first step in what we're doing. And there are other providers in integrative oncology. So there are nutritionists that focus in this. There are chiropractors, massage therapists, all kind nurses that focus in integrative oncology, even within conventional settings. It's really good to look at any cancer center for what integrative components they have built into their system, whether it's acupuncture or other types of services that really support patients during their trips into these settings, which can be very stressful for many people. So the goals of naturopathic oncology are to guide safe use of natural and supportive therapies for patients in active treatment or in survivorship. And I just want to add to that we use an evidence-informed approach. So at this point, we are looking at clinical trials and evidence to support best outcomes and even long-term outcomes in patients with cancer who combine natural therapies with the conventional treatment approach. So really helping guide and support health and well-being during their treatment. And then preventing side effects is our goal during that whole process of being diagnosed and receiving the best evidence-guided treatment and guideline-informed conventional treatment. And we'll also add to that some therapies and nutrition information and lifestyle and wellness information that can make a big difference for people as they're going through treatment. So a lot of education and advocacy happens during these visits. The goals of naturopathic oncology to continue are patient safety. So as I mentioned, 80% of patients report using natural therapies, and not all of those are working with an integrative provider. So what we're seeking to do is help educate and reduce and prevent things like drug-nutrient interactions with chemotherapy, radiotherapy, or targeted agents, and really advise on the safest, best tools for applying natural therapies, even including dosage and quality of supplements, and to really encourage patients to communicate with their other providers about those therapies that they're using, to really create a list before they go into their treatment center and make sure to pass that off, and to add their integrative providers to their medical records, providers who receive access to their records such as lab work and imaging, so that we are all working together. And then we would like to potentially augment the effects of conventional oncology care and provide maximal supportive care. And yes, data and evidence is supporting that we can augment the outcomes of the conventional treatment. So just a quick example of that, we have a new study that's in the knowOncology.org database of women who are diagnosed with ovarian cancer who, when they did the standard of treatment approach combined with use of something called green tea, EGCG component, and I3C, or indole 3-carbinol, they had even better outcomes in long-term survival than the conventional approach. And this is a wonderful study that's now being highlighted in the KNOW database. So I would encourage you to check that out. So we offer support for symptom management during the cancer treatment experience. A lot of times side effects are what stop people from going through their continued plan of care, their oncologist-driven plan of care. Things like neuropathy, nausea and vomiting, diarrhea are big reasons for delays in receiving the best treatment people can possibly get to fight their cancer. So naturopathic doctors and other integrative providers are really helping people adhere to those conventional treatment programs by reducing those side effects. Some of the chronic conditions you can see here, which we also work with people on while they're seeing us for their cancer treatment integrative care. So this is a great example of breast cancer, a study on breast cancer patients who reporting fatigue, who are reporting feeling very, very tired day to day at some point into their treatment approach. So these are some therapies that are evidence-based to reduce that fatigue. So Ganoderma is a mushroom supplement that at 1,000 milligrams 3 times a day has shown to reduce safely fatigue alongside conventional treatment and improving outcomes there. Ginseng also is safe, and 1,000 milligrams daily has been evidence-based in various forms of cancer to improve energy levels and reduce fatigue. Exercise is a wonderful one. We have some new oncology guidelines for exercise, which are wonderful. I believe it's 150 minutes per week that's recommended, even through stage 4 disease. So these are things that naturopathic oncology providers are talking with people about and recommending, and really supporting people to look for those programs that offer it, and looking at the individualized, tailored approach to what is this person most likely to gravitate toward for an exercise regimen? What is their personal experience in their home and family life that would allow us to recommend a specific form of exercise? So D3 is something that we've seen help with cancer-related fatigue, and we will often be testing D3 levels, and even the conventional oncologists are testing D3 levels with us as well and looking at that to optimize those if low. We work on sleep and nutrition as well. So what is some of the demand for integrative and naturopathic oncology care? In this survey of 453 patients on complementary and alternative medicine, that was published in the Journal of Clinical Oncology, we saw 83% used at least one CAM therapy at the same time they were receiving cancer treatment. So again, we're at that 80% level, and this was all the way back in the year 2000. And I'm finding that that number seems about right, or maybe even higher at this point. And 40% of those had not discussed use of those therapies with their physicians, and there are various reasons for that. So, 10 years ago, that wasn't necessarily a questionnaire, that was being raised during their intake or with their nurse or physician teams. And there are other reasons for this as well. 24% use 7 or more CAM therapies, so this is very interesting, and 41% of oncologists did regularly ask their patients about supplement use. And I'm seeing this become a common occurrence now too, but it can be very stressful. Having worked with oncologists for some time in the hospital setting, they're doing very detailed care and very advanced treatment planning and chemo orders. They don't have time to sit and talk with their patients about their integrative therapies, and they don't feel they have the expertise to know the evidence base for those. So it's very much naturopathic oncology and integrative provider driven, for looking at those therapies that are safest to use and do have evidence to support their use for very particular tumor types or for very specific treatments that are being done, like chemotherapy and radiation. So in another survey of 3,400 respondents, 87% used CAM therapy during cancer care. And that was a little bit more recent of a study in 2017. But again, that number is very high, and we know patients are using these therapies. So we're very much trying to answer the call in naturopathic medicine and be present in community and private hospital settings where we know we can make a difference in value-added services. There are now, naturopaths are now licensed in quite a few states, so we should be able to see these practitioners be welcomed and incorporated into hospital systems soon. But I do recommend, if you're looking for a naturopathic oncologist for a loved one, you go to the oncamp.org, and Joanne can put that again in the chat box for you, because there is a find a provider by state, which may be very helpful for you. So again, just some practice patterns about oncologists that are very helpful to know. I won't spend a lot of time on this, but again, at the bottom, 59% don't receive education about these topics, right? So we have maybe one nutrition class in medical schools. We have not a lot of education on this, and naturopathic doctors and then specialty training in oncology, we focus on this for at least 2 to 4 years in our training. So it's something we're working very closely with in terms of training our residents and having up-to-date knowledge of the data so that we can translate that and work with other providers in oncology to help create awareness of integrative therapies. So we do this because patients feel their needs and choices are supported and respected when doctors trained in natural therapies are part of their oncology care. We are advocating for patients to be a participant in their health. What can they do from home instead of just thinking about going into the treatment center as their main source of care? Self-care and family care and having caregivers are all a part of what we talk with patients about. And what patients access as a result of this care are some improved response to their treatments, reduced side effects, improved quality of life, health and well-being before, during, and after treatment, and then really hugely preventing recurrence and becoming active participants in maintaining health and longevity through their years. So let's look at some of the research in naturopathic oncology. It is ever growing, and we created the knowOncology.org database to hold all of this research, to really educate our clinicians and students and residents to know what the data is and to increase research literacy about this data. But we focus on human clinical data for decision making. That's very important. Many studies show the safety of natural therapies in humans with support for improving quality of life, side effects, treatment response, and survival. We'll look at some of these studies now. This is a really wonderful study that I would encourage you to look at, a randomized controlled trial of cognitive behavioral stress management and breast cancer survival, looking at recurrence 11 years later. These are women who are randomized to receive 10 weeks of stress reduction for 90 minutes a week. Versus a one-day seminar that included some handouts. And what we looked at 11 years later, we saw the benefit persist in the treatment group versus the control group. This is very amazing. This is huge information. So relaxation training and stress reduction had a huge impact on death related to any cause and recurrence of cancer. So this is something that we're talking with patients about actively. We're talking about relaxation training. Here's some more information on that Reishi Ganoderma mushroom that I was telling you about earlier. So this study is a wonderful study showing that 1,000 milligrams versus placebo for 4 weeks had decreased concentrations of tumor necrosis alpha factor and interleukin-6. You know, these are things that help drive cancer development and growth. So this is really wonderful. Fatigue improved, statistically significant improvement in fatigue, anxiety, depression, and sleep, improved cognitive function, and just global QOL. This was a really nice study. And these were for breast cancer patients receiving endocrine therapy stage 1 through 3A. So the number of patients in this is 48. This was a pilot clinical trial, but it's very indicative of being safe and showing support and no interactions and reducing a side effect that can be really cumbersome and bothersome for people. These are some other examples of studies that are guiding us in clinical care. So fish oil can help prevent some neuropathy with paclitaxel. Berberine can help prevent pelvic radiation-induced diarrhea. Zinc carnosine can help mucositis. These are things that we're working with patients to incorporate into their treatment programs. So this is a wonderful study that was actually done by a naturopathic doctor named Dugald Seeley, who's a leader in research and in naturopathic oncology in Ottawa, Ontario. So we have a really wonderful representation of Canadian naturopathic oncology providers in our profession as well. This was a systematic review and meta-analysis for women taking 20 milligrams of melatonin and having a complete response, partial response, and stable disease that was improved. So decreasing 1-year mortality is really, really amazing. And we found, and it was reported that melatonin was very safe in combination with other therapies. So you can see melatonin as an adjuvant care with and without chemotherapy in randomized controlled trials. So urge you to think about this and look at that study specifically if you can. And then this study on fish oil, 1.8 grams a day of DHA from fish oil supplements improved outcomes in metastatic breast cancer patients undergoing treatment with chemotherapy. These are some of the studies that we get very excited about. 2 case studies that I'd like to share with you. I just want to check time. Danielle was a 44-year-old Caucasian woman diagnosed with stage 2B invasive ductal carcinoma. Her left-sided tumor was 5.5 centimeters, pretty big. Grade 2, ER positive, PR positive, HER2 negative, and no lymph nodes. Her Oncotype DX risk of recurrence score was a 42, so on the higher side of risk for recurrence. Her breast cancer staging is there for you to see. Her conventional treatment was a mastectomy and chemotherapy with dose-dense adriamycin and Cytoxan, followed by Taxotere, so AC followed by T, which is the conventional guided approach. And then she began radiation afterward and tamoxifen. Her problem list on these treatments were insomnia with trouble staying asleep, anxiety, depression, fatigue, And she wanted to see if natural medicine could help her prevent the side effects and reduce them, and also if that could help her survival outcome. We tested vitamin D blood levels. We talked about therapies to use during radiation treatment, we're washing with gentle soap and water, clean, dry skin for each radiation treatment, sleep hygiene, really looking about how steroid medication can impact sleep, and cardiovascular exercise and nutritional counseling. The supplements that we chose to use with her were melatonin 20 milligrams, CoQ10 100 milligrams, and the Ganoderma, which you've heard a little bit about. Her vitamin D level was very low, so we really recommended 10,000 IU vitamin D3 daily, which with repeat blood work in 3 months. Her insomnia was much, much better after getting started with melatonin. And just having the education about sleep hygiene made a real difference for her. She did start doing more intense and focused cardiovascular exercise and had some weight loss that she intended and was happy with. And she was referred to an onco-specific nutritionist to help carry on her dietary goals. Her energy level improved, and that was her sleep and energy, are very connected. If someone's not sleeping, they're going to be very tired. So vitamin D and some melatonin and sleep hygiene and reconstruction really supported this patient very well. And just working with a naturopathic doctor where we do recommend relaxation strategies helped reduce her anxiety some, and having a prevention plan going forward in the future and having some things she could do proactively to support her health made a real difference. The second case study, hopefully I'm not going too fast, is Robert. So this is a really good one. He was a 61-year-old Hispanic male computer programmer with a history of testicular cancer at 35, which was treated with radiation to the pelvis, but then he was also diagnosed with bladder cancer after 3 months of hematuria later on at the age of 61. He reported taking supplements, melatonin, D3, and fish oil and probiotics on first intake. And then his conventional treatment for the bladder cancer was surgery with 2 cycles of preoperative gemcitabine plus cisplatin chemotherapy, but the patient didn't want to do surgery. So chemotherapy was started. He had 2 cycles of chemotherapy and then came to the naturopathic treatment inquiry, our first visit. What he was experiencing was toxicity from cisplatin after 2 cycles, where he was having numbness and tingling in his fingers that limited his ability to work. So he was a computer programmer and his fingers were impacted greatly. The patient and oncologist had discussed a treatment break, and that is at which time he came to us. He wanted to continue to work, he wanted to continue to treat his cancer, and he wondered if there was something natural he could do to help prevent the side effect of neuropathy. The supplements that we used, which were guided with his exact form of chemotherapy, were oral vitamin E. And then we also advised on fish oil, D3, probiotics, and melatonin dosages and how to take those and when. And this was a really wonderful case because within 6 days of starting the vitamin E, he had a full resolution of his neuropathy and went back to his oncologist to start and finish his 4 more cycles of chemotherapy. So this was a great story in a way that naturopathic approach can really help coordinate with the conventional treatment type of cancer. Last study, this is also a good one and a common thing that we hear. So Grace was a 68-year-old African-American woman with metastatic breast cancer who was upset with her conventional treatment at a leading academic center. And she saw an integrative approach because during her conventional treatment, she was put on a nausea medication called ondansetron, which caused her some nausea, headaches, and constipation. Actually, the medication caused her headaches and constipation. She was taking the medication for her nausea, but the side effect of the medication was really troubling for her. She tried to talk with her medical team, and they were not too supportive, and she got upset, and she actually changed treatment centers because of that. She really wanted to try and incorporate some natural therapies instead of using the medications that she knew weren't effective for her. And Grace's questions were answered about safe natural therapies for nausea. The treatment of choice with Grace was oral ginger, 200 milligrams 3 times a day, And we let the medical oncologist that she was newly treating with know the recommendation for ginger and gave a brief reference to the relevant human clinical data supporting that use for her very specific case. And at 3 weeks, she reported her nausea was controlled. She was thrilled. She only had to use conventional medication 3 times in 3 weeks versus daily. And she really preferred ginger, which actually helped her GI tract and her bowel, as well as satisfying her nausea. So this is kind of a good story where some simple tools can really help make a difference for patients. This slide is showing you some conventional treatment settings where naturopathic oncologists are working right now. So this is very exciting to us. This number is always growing. We can't possibly fit more on this slide, but I think there are more now. I'm looking at it, and as a leader of the naturopathic oncologists for the OncANP, I know that we could add a few more to this slide already. And I'm so happy for the opportunity to present to you all today. And I would really love to hear from any of you if you have further questions for me. And the organization, oncanp.org, of course. I'll turn over the slides to Dr. Yanez now, and thank you so much.
Thanks so very much, Dr. Wright. Actually, if you could advance to the next slide that has the events.
Yep, here I go. There we go.
Fabulous. So before we start our question and answer session, I just want to let you all know about some upcoming AANMC events. On August 6th, we will host a Food as Medicine webinar, and I know that there were already a couple questions about nutritional interventions with cancer. And so that will be strictly food as medicine. And then we will have a pain webinar on the 19th of September focusing on regenerative medicine in pain patients. So I'm really excited for that. Dr. Wright, I have a few questions for you in regards to some of the cases that you provided. So one of the first ones was if you could speak to naturopathic doctors providing services in pre-licensed states, and how do they access NDs in those areas? That would be wonderful.
Sure. So I've worked in unlicensed states the bulk of my career. So I went to a hospital in New York, and I was incorporated and credentialed through that hospital with the internal medicine group. And it's really a patient-driven incorporation for conventional hospitals. And when I moved out of the hospital systems as a licensed provider and going into private practice, I work with patients as a consultant. So not being a licensed provider in Pennsylvania, I maintain a license in Vermont, and I work as an integrative consultant for the people that are in my care, and oftentimes refer them to oncologists and treatment settings where I can work collaboratively with other providers. Hopefully that answers your question a little bit.
Thank you so much. There was another question about normalization of vitamin D levels. And I know the research is a little over the map on vitamin D. Can you speak to that a little bit and how you figure out what the optimal level is for patients?
Sure. I mean, vitamin D tends to increase slowly. I'm trying to think. There was a wonderful study that was done by a group of naturopathic doctors. I think Michael Traub was one of them, looking at how to increase vitamin D levels in patients and looking at the difference between, and I think Ryan Bradley was on that study as well, but looking at the difference between capsules and liquid dosing and shots that can be done in conventional treatment settings. And what we found was that the oral capsules really helped raise levels over time, as well as the shots. And we think that maybe the oral capsules may be a better way daily to have a gentle increase over time. It takes a long time. So that 10,000 unit dose daily may have looked high to some of you, but it rises very slowly. So we can only look every few months to see maybe a rise of 15 to 20 points if we're lucky. So, and what we're watching too when we dose vitamin D, we're looking at blood calcium levels to make sure those don't go high. And usually I don't see that, but I check. And, you know, I think that when I'm testing, now I'm seeing most of my oncology patients are getting that test with their blood work up through their oncologist. And the conventional normal level is kind of low, and naturopathic doctors work to get a little bit beyond that and follow the data on that. So there's quite a difference in what conventional docs look at as the normal level and what naturopaths look at as helping people become optimal and beyond.
Thank you so much. So I know over the years we've received a number of questions, and there's a question today about medical food formulations and nutritional approaches. I know that there have been, lots of patients will say, oh, I shouldn't eat protein, or I should eat protein, or whole foods or not whole foods, or juicing or fasting, or there's so much questions and concerns out there of what people should do. And then also into survivorship, what type of nutrition should people eat after they have finished cancer therapy? And so if you could speak to that a little bit, that would be wonderful.
Sure. So one of the most evidence-based diet and nutritional programs for patients with cancer that we know of is actually the Mediterranean diet. And I have a colleague, actually, a naturopathic doctor named Michelle Kokunda, who's in Italy. She was my director at a private hospital in Philadelphia and helped train me as a naturopathic oncologist. But she developed a really wonderful resource for patients on the Mediterranean diet. And I would really just encourage patients to look at that. I think there's a huge variance in practice patterns among naturopaths working with dietary measures, and we really look at the specific patient. What are they going through? What is their background? What is their life history? And there are very many diets out there that that patients find and come to us asking about. By and far, a varied diet that is very rich in plant-based nutrition is what we are recommending, and the Mediterranean diet and related diets to that have been researched are really showing the best benefit and outcomes. So until you see long-term evidence supporting the use of a particular diet in humans, I think it's best to stay with that plan. And so that's what I do, really focusing on moving toward a plant-based diet. How do we do that? How do we incorporate more of the Mediterranean diet into people's lives and lifestyles? And that can be some teaching. And I often refer to nutritionists for that work because I'm focused on so many other things with patients.
Thank you so much. I have a question here from a current naturopathic medical student and what they can do if they wish to work as a naturopathic oncologist in the future. What would be your recommendations to students?
Yeah, that's great. So we have a residency program, and most of the naturopathic oncologists are open to preceptors. And so I have, for instance, had a few preceptors come and work with me over the last 2 years. And if you're in a state where there's a school, you can go to the OncANP.org and look at the doctors that are practicing. The OncANP.org also has kind of resources for you to see what a residency in naturopathic oncology would look like. But if you're at the student stage of game, joining your school's oncology club is the first step, and then learning about preceptorship opportunities and potentially about the residency program would be a wonderful next step. So that's a great question. We would really like to see more students becoming involved in naturopathic oncology and really help build our residency program. We have so many amazing trained BABNOs in North America that are excited to train residents. And usually our training will send residents into conventional settings to work with providers so that they can gain that training. So for instance, in my training, I did a breast surgical oncology rotation. I did a rotation with a radiation oncologist, and many of our residency sites are building those programs for students. So it'll be very, very exciting as more students become interested in oncology to go through that process with us and watch that grow. I know that the schools have a lot of students that are interested in the specialties now, and it's an exciting time for that. And we often have referrals from my colleagues that are naturopathic family practice doctors that refer their patients to me during an oncology diagnosis. And that can be very exciting to then refer those patients back at the end of their care for their ongoing medical home and into survivorship to see them maybe once a year or every 2 years. Sorry for the long answer to that question, but it was a good one.
Thank you. Yeah, and I would add to that as well. My advice to students is always to start mentoring. Start seeking out mentors, start networking. It is never too early to begin that networking process. The ONC-ANP as well as other associations have, they have the ability to support students in going to their conferences. So you can, as a student, either go to the state or national conferences, specialty association conferences. And so, if you've identified early on that you want to focus on a specialty, it's not too early to begin going to those conferences as a student or volunteer. I'm sure that, many of the associations will take student volunteers on as well. So, there are so many different opportunities for you to come on board and start networking, start seeking out mentors, start really trying to figure out how you are going to practice as a naturopathic doctor. And I tell folks, I said, there are so many different ways to practice as an ND, and that's the beauty of the degree, the flexibility of how you can operate. And even within ONC-ANP, I know many of my friends have many different ways that they practice. Some are, like Dr. Wright said, in hospital settings. Some are in integrative medical settings and outpatient care settings. And others do consulting work. I have a very good friend of mine who had a wonderful practice in Colorado for many years, and now she travels the globe, and she works with conventional doctors and patients in integrative oncology, but more from a consulting position. And so, I just implore you, do your research, find out all the different ways that you can use the degree and what resonates with you. And so that would be the only other little piece that I would add to that. Sorry, Dr. Wright, to butt in there.
No, I think that's wonderful. And I think just even outside of the naturopathic profession, I networked with my hometown hospital. So in my third year of school, started making those connections of people that I knew that were working in that medical center and hospital setting. And so that really building bridges to conventional sites of medicine outside of the naturopathic scope to educate is a really good step too. So I think for my fourth year, I did a presentation for the board at my hometown hospital on naturopathic medicine. So, yes, working with other naturopaths and looking at what they're doing is good, but also kind of striking out on your own to educate is also really great as well. And I think
I will add that she got a job out of that.
yeah. And all of the naturopaths that are out there practicing are really amazing resources. I wouldn't have gotten halfway where I am without all of the naturopaths who came before me saying, here's what you can do, here's what you can do. So you will find a lot of support from the community, just as I did, to help you along your way.
Thank you. So there was a question, just circling back to your case number 2,
Yes.
where there was a recommendation for vitamin E. And can you speak to the rationale behind that? Was that for angiogenesis, or was there another reason behind?
So there were about 7 clinical trials for his specific type of chemotherapy that were looking at vitamin E and the impact of neuropathy. And so the NO database in our work, when you search that chemotherapy, that cancer type, vitamin E came up strongly for preventing neuropathy. And so that really guided us in that approach. And so that's kind of the value of the NO database, is that you can look and see what research is very specific to oncology and to that patient care, and what are the mechanisms of action for that. So as a naturopathic doctor, reading those studies and understanding the mechanisms and what's at play, along with the other medications that patient is on, and seeing if I can apply that safely, what was at play for that case. So hopefully that helps. But if you go to, even if you are unfamiliar with nooncology.org, I hope many of you will become familiar with it. But you could also go to PubMed and select human and vitamin E and neuropathy and the chemotherapy type, and you'll see some of that data that drove our decision making for his care.
Thank you so much. So a couple more questions for you. And this is one that I ask all of the speakers. Um, it, what would be the one thing that you would have told yourself, the one piece of advice you would have told yourself upon starting naturopathic school?
Hmm. Hmm. Gosh, I had such a good experience oh, yes, I've got it. Okay, so here it is. It's to use the medicine. So once you start naturopathic school, you're in a program that's very rigorous. You're working hard. You're trying to stay healthy yourself. But go to your clinic, go to your school clinic, and start working with the medicine and looking at clinicians that are using it and working with them as a patient. And there's no time like the present to do physician heal thyself work. I recently heard a lecture by a really wonderful woman, Louise Edwards, in Michigan, who reminded me of the heart of naturopathic medicine. And she taught many of our theory classes at Bastyr, and along with Bill Mitchell. And it was just really a reminder for me that when I was going through school, I was helped so much and learned so much about our medicine by using it and practicing it and finding out how it worked for me. And I really think you need to take care of yourselves and nurture yourselves and stay focused on, self-care, because caring for a lot of patients and maybe your families and other folks, or in your careers, gets to be a lot. And so making sure to always care for yourself is what I would probably have told myself.
Physician heal thyself, right?
Yes.
I know in school we had a class titled Physician Heal Thyself,
Yes.
and it was very often I'll get asked questions, what's so special about naturopathic medical school? And I say, we walk our talk. Maybe not 100% of the time, but 95 percent of the time we're walking our talk. We're teaching ourselves along with our patients on how to recognize our stressors, on how to know when you need to tune in and take stock, and okay, maybe I'm not getting enough sleep, or maybe oops, I haven't been exercising enough, or uh-oh, I'm stress eating again.
Yeah.
And so that awareness that we teach our patients is also vital for us. I've always kind of joked with folks, I would have been a really, really sick young adult had I not gone to a different educational background, because I had some really unhealthy habits and poor stress management when I started ND school, and I learned all of that. And that was one of those things we call the hidden curriculum.
Nice.
It's not necessarily in writing per se. You study anatomy and biochem and nutrition and all of the different manipulative therapies and botanicals, etc. But that hidden curriculum in naturopathic medical school is the social support Dr. Wright was talking about, the colleagues who are willing to help you and lend a hand, folks who are willing to call you out and say, hey, dude, you're way stressed. Go take a break. So I think, that to me is the beauty of the education and the beauty of the profession. And I've always recognized I would be one really sick cookie had I not gone to ND school. So thank you for sharing that. That's really important.
Yeah.
So I'm not seeing any additional questions right now. Can you throw up the slide on how folks can reach the OnCANP?
I would be happy to. This is the contact for the OnCANP. And if you are not a naturopathic doctor yet and you're a student membership will help give you access to Know right now, knowOncology.org. And if you are an allied provider or an integrative provider or a provider interested in integrative medicine, the OnCANP has an allied membership option, which will also give you access to the integrative database that we built called Know. So that's a huge resource and a huge value for anyone who wants to take a look. And Corey Murphy is our wonderful executive director of the OnCANP, and you can email her at oncamp@gmail.com. And this is me, and I'm also a resource to you if I can be. And thank you so much for entertaining this presentation, and I wish all of you the best in your future careers.
So thank you, Dr. Wright, so very much for joining us today. Folks, we will have this recording sent out tomorrow. I see that there are a couple questions still coming in. Can I get access to the slides? We will have the recording available and sent out via Zoom. So stay posted, stay tuned, and that will be available to you pretty shortly. So thank you again, Dr. Wright. Thank you so much for this great and really informative chock-full webinar. And I look forward to seeing you around at our naturopathic events sometime in the future.